All right. So a little bit of background on the Urban Indian Health Institute. UIHI, as we are called, was established in 2000 as a division of the Seattle Indian Health Board. We are located in Seattle, Washington. We serve the urban American Indian Alaska Native communities across the country, but we are located here in Seattle. We are one of 12 tribal epidemiology centers funded by the Indian Health Service. The other tribal epidemiology centers have a regional focus, working with tribes across the country. And then as the Urban Indian Health Institute, we support urban Indian health programs funded through the IHS nationwide. This map shows you where all of the other tribal epidemiology centers are located. We offer a variety of epidemiology and data support work. So we focus on technical assistance, data request, research, reports, and trainings. Our service area is typically the urban Indian health programs, but through this new opportunity with Branch, we are able to offer additional services to other urban Indian organizations nationwide. This is a new opportunity for us, and we're very excited to grow our network. Branch stands for Building Resiliency and Action to Nurture Community Health. This is a new program of the Urban Indian Health Institute. This came through a funding opportunity provided by the Centers for Disease Control and Prevention, the National Center of Chronic Disease Control and Prevention and Health Promotion. So this funding opportunity started for us in September. It is a 5-year initiative that will allow us to help build public health infrastructure amongst urban Native communities. Through our model, we'll be looking at culturally based indigenous methods, frameworks, and evaluation approaches to improve the health and well-being of urban Indian communities. There are a variety of projects that will be housed under the Branch program. This community grants opportunity will be offered every year for 5 years, and we're really excited to bring this to our network. The goals of Branch: we seek to strengthen the urban Indian public health infrastructure, specifically by building capacity, improving access and opportunities for preventative care, addressing health disparities in urban Indian communities. We use innovative, culturally grounded methods supplemented with scientific methodologies. So our focus here is really putting Native ideologies first and supplementing with Western science. There are 4 major components of the Branch initiative here at UIHI. I'll be talking about 2 of these in more detail today to give you a little bit of idea of some of the community grants opportunity and the community of practice that will be open to the entire Urban Indian Health Network, so urban Indian organizations nationwide. We also locally will be doing some public health internships that will grow nationally, and community health profiles that look at health indicators amongst urban Indian communities across the country. Some information about those 2 components are available on our website, and there'll be more to come about those in the future. So specifically looking at the community grants program and the community of practice, these are 2 components that will likely be of interest to folks here on this webinar. The community grants program is, as I said, it's an opportunity where we'll be offering up to 4 awards a year for the next 5 years. In this first year, we're looking at diabetes prevention and management programs that use that approach things from an indigenous perspective. And then in future years, those focus areas will change. We're really focused on chronic disease prevention and control, so we'll be looking at things like cancer and other disease prevention opportunities in future years. In addition to the actual grant award, we'll have a community of practice that is open to everyone. So this will include technical assistance and training opportunities that don't necessarily come tied with the grant funding. So if folks are not awarded the grant in this first year, there's still opportunities to join the community of practice and be involved with the Urban Indian Health Institute. We've already scheduled and outlined several training opportunities over the course of the year. One of interest would be a culturally adapted traditional foods module that looks at traditional foods for urban Indian communities. That's a training that we'll be hosting in September. So keep your eyes and ears open for that opportunity. And then there'll be a variety of others that will surface over the coming months. This next section will get a little bit more specific about the actual grant program, the eligibility and grant information. So I'm basically going to be reviewing the guidance document, and then we'll open it up to questions. So if you have specific questions about things you read in the guidance, I'll be asking for those momentarily. So this year, as I said, we'll be doing an Indigenous approach to diabetes education, prevention, and management.
How's the grant?
We'll be looking at awarding up to 4 applicants in this cycle. The program year is somewhat abbreviated this year, so the funds will be accessible February 15th to September 30th. Future cycles, it will be a full 12-month program year, September to September. We're just a little late getting started this year, so that's why we're looking at an abbreviated time period. But the applicants will receive the full, or the awardees will receive the full funding amount of $10,000. There are some eligibility requirements associated with this opportunity. We'll be funding urban Indian health programs, which are Title V programs as defined by the Indian Health Service. We also will fund members of the National Urban Indian Family Coalition and or folks that are involved in MSPI DBT funding through the Indian Health Service. I've listed a variety of priority approaches here, examples of diabetes education, prevention, and or management activities that that we're suggesting, but this is not an exclusive list. So if you don't see an idea on here, but it's something that your program is currently doing or interested in pursuing, please feel free to either, you can always ask us and we can provide information and feedback, or you can propose something new to us that you feel still meets diabetes prevention, education, or management activities from a different perspective than the ones we've provided here. The funding options, since the source of this funding is tied back to the Centers for Disease Control and Prevention, our federal partner, there are some basic funding restrictions. So funds are not used for research or clinical care or to purchase furniture, equipment, clinic and patient supplies, but they are used for reasonable project purposes. So that should be pretty standard to some of the other grants that you may have worked on with federal partners. But if you do have specific questions about items in your budget, feel free to reach out to me and we can discuss that in more detail. The applications, so the instructions, I'll bring up the guidance here in a moment, but there is a detailed guidance on our website under the Community Grants Program. So www.uihi.org. Under resources, there's a drop down for community grants. That is where you'll find all of the information that you should need to apply for this opportunity. The full guidance is about 5 pages. It outlines everything you're seeing in these slides in even more detail. And it gives you some detailed instructions for how to submit applications for the RFA. So we will do electronic submissions. You can email them directly to me at francescam@uihi.org. Just put in the name of your agency, RFA branch submission. The applications, we're asking that they be turned in by the end of the month. We know we're on a really short timeline here. We wanted to make sure that folks get the funds as soon as possible. So that's why we're looking at a very abbreviated announcement and application review time process. So we appreciate everyone working with us on this. So if things are looking tight, please reach out and let us know so we can know what's going on with all of the applicants. There are 2 components of the application. One is the application form and work plan. This is also should be pretty straightforward. We're looking for some basic background information about who to contact at the agencies. There's a couple of questions that help us understand a little bit more about the work that you all are doing, and then a work plan proposal. It does not need to be the final work plan, but we're asking folks to identify 2 objectives and some details around what would be done over the course of this program year, and what kind of outcomes will come from that, what impact we're looking at. And then the second form is a 1-page budget worksheet and justification. This is just a simple itemized budget. that will detail how the funds will be used within your organization to meet your objectives. If you have questions about filling those out, we're happy to help with that part as well. And the forms are downloadable on our website, either as a fillable PDF. So if you have Adobe Acrobat, you can just type right into those. If not, you can download the Word document. The Word document has some formatting in it, so it can be a little tricky. So if it starts to look crazy, just let us know and we can help you figure out how to get all that content in there, because it'll start moving around on you. So we understand the challenge there.
I'm trying to really hear.
And then important dates. This is also available on the website. Our timeline is tight, so we released the RFA January 3rd. We're hosting the webinar now. Everything will be available online. We'll be accepting applications till the end of the month. We have a really quick review process. We'll be scoring all of the grants through an internal committee here at the Urban Indian Health Institute and letting folks know right away within a week if they've been selected for this year's list. And then funds the first disbursement should be released in February, and then program year ending in September. There are, and there will be, some components attached to performance measurement and evaluation. So we here at UIHI are deciding how the RFA and community grants program will be evaluated. So grantees, 1 to 2 times a year, will be asked to submit some small information about progress reports, basically about what's going on and how the funds are being used, and we'll ask for a few performance indicators. In your work plan, you'll be able to suggest some of that information to us about how you'd like to track and evaluate your project internally. That will help us inform how we'll be looking at the program as a whole. If this is also available, if you have any questions about the application, you can always reach out to me directly and we will step in. So one second, I'm gonna screen share. It's hard for me to see all of you, so I'm just gonna navigate around here and then we'll open it up for questions. All right, I'm going to stop the screen share so that we can see everybody. Great. And does anyone have questions that they'd like to start? You can do in the chat, or you can just speak if you unmute yourself and speak to the group. And if I muted you on accident, that was from the background noise. You should be able to still unmute yourself. All right. Any other questions? Are folks familiar with, have they been able to look at the full guidance on the website? I can pull that up as well just to show people where to find all the materials you'll need to fill out your application and information about the program as a whole. One moment, I'll pull that up for folks and we can just take a look at that. Yeah, so to Cynthia's question about materials post-webinar, those will be available through our website, www.uihi.org. I'm going to pull up the website now and show you where you can locate those. I am recording today's webinar and I'll be able to post that information as well as the slide deck. And then a couple of other questions coming in about the possibilities of multi-year funding. So right now we are looking at funding each agency only one time over the life of the grant. but I think that is still under discussion. But right now they are 1 year $10,000 grants per organization. And as I said at the beginning of the webinar, for folks who didn't hear, the content areas will change. Branch is focused on chronic disease prevention and health promotion. So this year we're looking at diabetes prevention and management practices. Next year we're looking at cancer prevention. So over the 5 years, we'll have different chronic disease priority areas that are highlighted. If folks have other questions, feel free to drop them into the chat or to unmute yourself and ask to the group, whatever you prefer. I'm just going to screen share real quick again with our website, give you an idea of where you can locate all the materials. So many buttons. All right, how's that? This is the UIHI website, Urban Indian Health Institute, uihi.org. Under resources, you'll go down to community grants. There are a variety of other resources, so if you're not familiar with us, feel free to peruse the website, see what else you might be eligible for service-wise, or if you're just interested about who we are as an organization and the kinds of work we're doing. But for the community grants program, all the information you'll need to know will be provided here. There's some background information on the initiative and our priority approaches this year, the number of awards, the funding amount, and eligibility requirements. Important dates are also available. Here on the left sidebar, you can click How to Apply. There'll be another link here later today that will say Pre-Application Webinar Materials. That's where you'll find these slide decks that we just went through. Under How to Apply, you can locate the request for applications. This is the full guidance. It's about 5 pages. It goes into more detail about why we're looking at diabetes prevention and management, more detail about the priority approaches, and some important information for those of you that will actually be applying and filling out these applications. You also can access here's when I mentioned the work plan and budget. The Adobe fillable form is available. You will be able, if you have the right Adobe product, to just type into these fields. There's about 5 questions and then a work plan. And as I said, this is your proposed work plan. Applicants who are selected to be recipients of the funds will refine and solidify the work plan once they've been approved for the funding. So put in here what you are thinking about doing, how you're thinking about tracking it, etc. And then same with the budget form. You can either download the Word document or you can do the fillable form. And this is just a 1-page itemized budget that should correspond to the activities you're proposing in the work plan. I think this covers the important materials. And I mentioned at the beginning the community of practice that we'll be hosting through Branch. That is open to everyone, regardless of if you're awarded the funds this year. You have access to a variety of trainings and technical assistance. That will be, we'll be revamping sections of this website where you'll be able to see what those training opportunities are as they are solidified, and you also will have access to request technical assistance. So folks who are interested in that, please feel free to reach out to me if you want to build a more connected relationship moving forward, or if you'd just like to check the website periodically, learn a little bit more about what's going on. Just a sec, I'm going to check a couple questions coming through the chat. We had a question again about the multi-year funding. I will need to get back and I'll post this on the website. I believe that applicants will only be eligible for 1 year, but let me check with the branch program here at UIHI, and I will put a solid answer on the website for everyone, because I know that will be a good question. The link on the, okay, so it looks like the link to the application form and work plan may not be working in the slide deck. My apologies. That is the same form that's available on the website. I will update the link in the slide deck before posting it to the website. Thank you for that. Any other questions? All right, so if folks have specific questions for me about priority approaches or programs that they're interested in pursuing, feel free to reach out to me directly. I see a couple folks are mentioning that they'd like materials or they'd like to speak offline through the chat. That's great. I will be in touch with you. And please direct yourself to the website if you are looking for materials or resources over the next couple of weeks to fill out your application. We're really looking forward to starting this branch community grants program and growing it over the next 5 years. So we thank everyone for coming to this webinar. We were a little worried about attendance given the short timeline, but it's really great to see so many folks that are interested in this opportunity. We're looking forward to reading your applications, and we hope to be connected to all of you very soon. So thank you. I'll go ahead and close out the webinar unless folks have questions.